I'm going to be talking to you about substance abuse, particularly that involving addiction to prescription medications. The goals of this presentation are to understand the prevalence of prescription drug abuse, why people become addicted, some of the different risk factors, the signs or symptoms of abuse, and some possible treatment plans. You may be asking yourself, what is prescription drug abuse? According to the Mayo Clinic, prescription drug abuse is the use of any prescription medication in a way not intended by the prescribing doctor. This includes everything from taking a friend's prescription painkiller for your backache to snorting or injecting ground-up pills to get high. Prescription drug abuse can be classified using the ICD-10 under Chapter 5, which is titled Mental and Behavioral Disorders Due to Psychoactive Substance Use. It can also be classified using the DSM. 5 would be the most recent, but I have also included 4 just for your reference. It's very important to understand that DSM-5 breaks down the substance use disorders based on the type of prescription medication being abused. Prescription drug abuse is becoming more and more prevalent. It's currently the second most abused class of drugs, right behind marijuana. Approximately 52 million people have abused prescription drugs in some way. 14% of people who reported non-medical use also met the criteria for a dependence on those prescription medications. In 2010, a survey of high school seniors stated that 1 in 12 had abused Vicodin and 1 in 20 had abused Oxycontin. What is the etiology or cause of addiction to prescription medication? The U.S. Department of Health and Human Services believes that addiction is a chronic, often relapsing brain disease that causes compulsive drug seeking and use, despite the harmful consequences to the individual who is addicted and to those around them. Other possible reasons for prescription drug abuse are to feel good or get high, relax or relieve tension, to reduce appetite, to increase alertness, to experiment with different mental effects, to maintain another form of addiction, to prevent withdrawals, for social acceptance, or for caving into peer pressure, or to try and improve concentration or academic work. Now let's take a look at some common risk factors. Gender, age. We typically see an increase in prescription drug abuse in the teens and early 20s. Socioeconomic status, past or present addictions. This includes tobacco and alcohol. Family history, psychiatric conditions, a social environment containing drug use, easy access, a lack of knowledge, or multiple health problems. We typically see that with older adults. How are people obtaining these prescription drugs? The first thing we need to understand is that prescription drugs are more readily available today than they have been in the past. Doctors are frequently prescribing these medications due to an increased knowledge and prevalence of different disorders. There is still the common way of getting these drugs through the illicit means, such as friends, stealing, or dealing. But we're seeing a new means of obtaining prescription medications, which would be taking them from a family member who has a valid prescription. We're also seeing people manipulate healthcare providers or visiting more than one provider to get prescription medication. Physical dependence is one side effect of prescription addiction. People can develop a tolerance, which is a result of long-term use. Increasing tolerance will result in a need for higher doses to get the same effect or experience. Withdrawals can be experienced when cutting back or stopping use. These are seen as physical symptoms that include things like tremors, sweating, and tension. Some complications from opioid use would be low blood pressure, slowed breathing with the potential to stop, coma, and a significant risk of death with overdose. Some complications seen with sedative and anti-anxiety use are memory loss, low blood pressure, slowed breathing, withdrawals, which include nervous system hyperactivity and seizures, and a significant risk of death or coma with an overdose. Some of the complications due to stimulants are high body temperature, heart problems, high blood pressure, seizures or tremors, hallucinations, aggression, and paranoia. What are some potential consequences of prescription drug addiction? The typical risky behavior, or moving on to more illegal drugs such as heroin, involvement in crime, car accidents, troubled relationships, and decreased work or academic performance. Some signs and symptoms to be aware of for opioid use would be constipation, nausea, euphoria, slowed breathing, drowsiness, confusion, and poor coordination. For sedatives and anti-anxiety, you should look out for drowsiness, confusion, loss of balance, slurred speech, poor concentration, dizziness, memory issues, and slowed breathing. Some signs and symptoms for stimulant dependence would be reduced appetite, agitation, high body temperature, insomnia, high blood pressure, irregular heartbeat, anxiety, and paranoia. Two common treatment approaches are the 12-step program and cognitive behavioral therapy, or CBT. 12-step program is adapted from the principles of Alcoholics Anonymous, but for this particular disorder, it would be called Narcotics Anonymous. It is a biopsychosocial spiritual model that believes addiction is an entrapping, interlocking set of 4 vicious cycles: physical, psychological, social, and spiritual. Cognitive behavioral therapy deals with the idea that disordered thoughts cause disordered feelings and behavior. They don't believe addiction is a disease like the 12-step programs, but rather a habit, and they focus on habit change with 3 strategies: functional analysis of disordered thinking, skills training to increase adaptive coping responses, and relapse prevention. So what about what we do? What about occupational therapy? Occupational therapy most definitely has a place in addiction treatment. Addiction affects people's occupations, and with the paradigm shift of occupational therapy from a medical model to a more client-centered model, we are now more than ever equipped to help those suffering from prescription drug addiction. Occupational therapists can provide clients with a critical look at their daily routines and determine how drugs play a role in their life. OTs can also assist in the reestablishing of roles and meaningful activities. OTs can typically be found in partial hospital rehabilitation or short-term rehabilitation programs. There are some OTs that are specifically specialized in drug or alcohol abuse. People can go to them without having to go into a program to get their desired help and return to their daily activities. Thank you for taking the time to watch my presentation, and here I would like to give credit to the different references that helped me make this presentation possible. I hope that by watching this video, you gained a better understanding of the seriousness of prescription drug abuse.